college students and young adults. Drug czar John Walters, he's still there, says that this survey confirms that our drug prevention efforts are working and that when we work together and push back, the drug problem gets smaller. Like a lot of people in Washington, he doesn't always thoroughly read what he talks about. Because what the report says is that between 1991 and 2002, marijuana use among students in all school grades increased 30%, 12th graders, 65% for 10th graders, and 88% for 8th graders. They've been bragging recently that marijuana use among young teens has gone down in the last couple of years, and actually it has a little bit. That the current number is still 15% higher than it was in 1992. So it's still significant. School children report it's easier to buy illegal drugs than it is to buy cigarettes, alcohol. Why is that? No, I know you know. Who knows? You have to be licensed to sell it.
Because illegal drugs are not regulated.
Right? And they can sell to anybody. Corner stores are supposed to ID you, and now they have this. It's a new government thing, weid.gov. Have you seen those signs in the highways and all that? They have a website about ID before they can sell you alcohol or tobacco and so forth. It's on record that people or youth as young as age 4 can buy drugs and have bought drugs from drug dealers on the streets. Because they don't care. They just want the money. Show me the money, you got the product. No regulation. Right now, the drugs are in the hands of criminals. They're controlled by criminals. In other words, there is no control of the drugs and the drug problem that goes with it. The illicit trade internationally in annual drug trade, I should say, $500 billion. If you ever learn how to speak, I'll talk more. Put that in perspective. In 2005, the entire budget of the U.S. Department of Defense was $100 billion less than the international trade in drugs. Let's talk about annual causes of death very briefly. Everybody knows about tobacco. Approximately 435,000 deaths related to the use of tobacco, according to the Journal of the American Medical Association. Poor diet, physical inactivity. I'm kind of guilty of that these days. 365,000. Alcohol, 85,000. Microbial agents, 75. Toxic agents, 55. Motor vehicle crisis. That number is way down from what it was when I was investigating fatal accidents. Down to 20, it used to be about 40,000 to 50,000 a year in the 70s. 26,000, not bad. Safety, education about drunk driving. Adverse reactions to prescription drugs, 32,000 deaths.
That is terrible.
We should outlaw doctors. Suicide, about 30,000. Incidents involving firearms, 29,000. Homicide, 20,000. Sexual behaviors. This guys? Huh? Girls? Doesn't say what behaviors, just sexual behaviors. 20,000 deaths. Illicit drug use. 17,000. All this hullabaloo for 17,000 deaths a year. Non-steroidal anti-inflammatory drugs. 7,600 people. And for your normal people, nobody dies from using marijuana, although they might get involved in that 20,000 figure up there. But, you don't think so? George Norml, you may not know who he is, but he's an economist who wrote in the Wall Street Journal. In 1933, the U.S. finally gave up the 13-year prohibition of alcohol, only 13 years. A drug that by some measures is more intoxicating and dangerous, let me speed this up, to health than marijuana. That effort to alter human behavior left a legacy of corruption, criminality, of deaths and blindness from the drinking of bad booze. America's use of alcohol went up after repeal. But no serious person today suggests a repeal of the alcohol experiment, repeat of the alcohol experiment. Yet prohibition is still being attempted at great expense with a small portion of the population, perhaps a little more than 5%, who habitually use prescribed drugs. 2002, they did another study. How are we doing in the war on drugs? Beating it? What's going on? Let's do another study. Let's see how many addicts we have now. We've got all these people using drugs now. There's got to be more addicts around. I guess, anybody? Yep. It's a pretty constant figure, percentage of the population. Of course, there's a few more people around in 2002 than 1914, but the percentage remains the same of actual addiction to drugs, according to the government study. In March of this year, I call it the Royal Society of Everything. If you want to read that whole title, you can. They did a 2-year study, and they made recommendations about what Great Britain should be doing about the war on drugs. Calling for an end to drug prohibition. I'm just going to read you some of this. They call it drugs facing facts, and this is a partial list. They said drug use should be seen in the context of our use of alcohol and tobacco, which is often far more harmful. Anybody here disagree with that? Alcohol and tobacco? Drugs policy should, like our policy on alcohol and tobacco, seek to regulate use and prevent harm rather than to prohibit use altogether. Illegal drugs should be regulated alongside alcohol, tobacco, prescribed medicines, and other legal drugs in a single regulatory framework. The remit of the Advisory Council on the Misuse of Drugs or any similarly constituted body should be extended to include alcohol and tobacco. And if my thing works, the aim of drugs policy, again, should be to reduce harm. That's the crux of the thing. The widest possible promotion of harm reduction measures should be an integral component of a pragmatic drugs policy. That's the recommendation of the Royal Society of Everything. Drugs treatment should be viewed primarily as a health and social issue and should be less heavily influenced by the demands of the criminal justice system. And then they say that their Misuse of Drugs Act, similar to our Drug Act, should be scrapped and replaced with the new Misuse of Substance Act that sets drugs in a wider context of substance abuse, misuse alongside alcohol, tobacco, and other psychoactive substances, and is linked to an evidence-based index that makes clear the relative risk of harm from individual substances, and seeks to focus punishment mainly on harmful behaviors stemming from drug use rather than the simple possession of drugs. Like we do with alcohol nowadays. Drink yourself stupid, but don't go out and harm anybody when you're drunk. That's the crime, and that's what you should go to jail for. That's what we think should be done with drugs. Later this year in June in Los Angeles, the U.S. Conference of Mayors had one of their conventions. That's made up of mayors of all cities, 30,000 of population or more. They came out with this whole list of whereases. This is only a partial list. They've been long concerned about the substance abuse and impacts on cities of all sizes, and this conference recognizes that addiction is a chronic medical illness that is treatable. And drug treatment success rates exceed those of many cancer therapies. And according to the 2005 National Survey on Drug Use and Health, an estimated 112,085,000 Americans aged 12 or over, 46.1% of the U.S. population aged 12 and over, have used an illicit drug at least once. And whereas the United States has 5% of the world's population with 25% of its incarcerated people. At a rate of 1 in every 136 U.S. residents, highest in the world. 55% of all federal and over 20% of all state prisoners are convicted of drug law violations, many serving mandatory minimum sentences for simple possession offenses. And drug treatments are cost effective. A study by the RAND Corporation found that every additional dollar invested in substance abuse treatment saves taxpayers $7.46 in societal costs. A reduction that would cost 15 times as much in law enforcement expenditure to achieve. And goes on, purity levels going up. We already talked about that. All independent analyses have found that the ONDCPs, the Office of National Drug Control Policies, drug prevention programs are costly and ineffective. The Government Accounting Office recently found that both the National Youth Anti-Drug Media Campaign and the Drug Resistance Education Program, DARE, I had several of those guys working for me, and not only failed to reduce drug use, but instead might lead to unintended negative consequences. Talk about women.